is Jenny Peck.
And my name is Jeff Knight, and we currently volunteer for a non-governmental organization in Tanzania, East Africa, called Fox's Community and Wildlife Conservation Trust.
The NGO works with people living with HIV/AIDS and orphan care, and we'd like to share with you most of the projects that make up our attempt to address the tremendously present issue of HIV/AIDS in our project area.
We are located in East Africa in the country of Tanzania, in the regional province of Iringa, in the district of Mufindi.
Specifically, our project area is mainly 16 villages in the southern part of the district.
Infection rates for HIV/AIDS in Mufindi district are some of the highest in Tanzania, whereas between 6 to 8%, or about 1 in 12, of the Tanzanian population as a whole is estimated to have HIV/AIDS. The Iringa region has the highest incidence of HIV/AIDS in the country, and the infection rate in the Mufindi district has been measured to be 16%, or the highest in the region. Up until late 2009, there was only one village dispensary in our project area with the capability to test for HIV/AIDS. The percentage of the local population testing positive for HIV/AIDS between 2005 and 2009 in that dispensary was 35%. At the high rates of infection prevalent in Mufindi district, the number of orphans is not the only concern. At these rates, entire village structure, both socially and politically, is on the verge of collapse. A holistic, community-focused approach is needed.
Our NGO was initiated by the Fox family that has a history in Mufindi, Tanzania of over 50 years. The idea to start an NGO began when an orphan child asked the Fox family for work at the Fox business, and due to the child's age, there was no legal way for the family to employ him in Tanzania. As more and more children came asking for work, the reach of the AIDS pandemic into our community and the necessity to do something about it became clear.
Fox's NGO has since created a multifaceted, holistic approach to addressing the issue of HIV/AIDS in the community. This approach is what we would like to share with you in this video.
To explain how we got involved with the NGO, we would like to tell you Alice's story. Alice was a woman from our village that was HIV positive, and contrary to what I was told about working in the village in Africa, she was very open and not shy to talk about HIV. In fact, she came to my door and introduced herself saying, "Hi, my name is Alice. I have 2 children and I'm HIV positive. How can you help me?" This is when I connected with Fox's NGO. I was a U.S. Peace Corps volunteer at the time in a rural village that happened to be in the project area of the NGO. This is how I learned about the organization and how they work with people living with HIV/AIDS and orphan care.
Jenny then told the volunteers at Fox's NGO about Alice's situation, and they organized transportation for Alice to get treatment for HIV at the closest town. Treatment was impossible for most villagers, including Alice, because the closest facility that gave HIV treatment was in a town over 50 kilometers away, and a 4 to 8 hour bus ride depending on the season. Also, bus fare was $10, so for people like Alice who are living off about $1 a day, treatment is impossible when you're trying to sustain a family. After the NGO helped Alice by providing the bus fare for her transportation, she began to bring other HIV-positive members of the community to our doorstep.
After only a few months, we had nearly 200 people at our door per month asking for bus fare to get treatment. This was remarkably significant, not only in the sheer number of people that had started treatment after Alice's example, but it was 200 people per month being open about their HIV/AIDS status, which is unprecedented in the area where HIV is a very taboo topic. It only took one woman's courage to start a movement that initiated a grassroots development for a community ravaged by AIDS to seek treatment and start living again.
Eventually, because of the overwhelming number of people that were receiving treatment through the transportation program, there needed to be a more practical way to get people treatment. The number of patients that wanted and needed to go to Mafinga town to get the closest treatment was becoming overwhelming. At this point, the NGO worked together with the government and invited the Mafinga healthcare staff to come to the village twice a month to Umdabulo dispensary in the village to test blood and dispense medicine in the village where more people could have access to the treatment. On April 21, 2008, Umdabulo dispensary had its first CTC day. This is the local term for the day occurring twice a month when the staff from the Care and Treatment Clinic in Mafinga town travels the 50 kilometers to our village and gives treatment to patients in their local setting. On this first visit from the staff from Mafinga, over 100 new patients came to be registered for treatment in the Mafinga CTC system. After only a few visits, there was another surge in the grassroots movement as more people became aware of the accessible treatment.
2 months later, the staff from Mafinga, together with the local staff at the Mdabulo dispensary, a total of no more than 9 healthcare providers, were seeing over 300 patients in one day, and over 700 patients were registered for treatment of HIV. Today, over 400 people come to the CTC day, and over 1,000 patients are registered. This drastic change from virtually no one getting treatment for this disease and no one even talking about the disease to over 1,000 people getting treated and becoming ambassadors for good health happened in less than 2 years and was started by one woman who had the strength and pride to stand up against this dangerous pandemic.
After consulting local and district government at the start of 2009 and a sizable donation from an American foundation, plans were in place for the NGO to construct a CTC facility in its own village. This would mean that treatment could be more comprehensive for people in this remote area, and even the other aspects of CTC treatment, such as prevention education and adherence counseling, could be made available to everyone. Construction is almost complete, and a full-service facility will soon be open for the community, and another push to this grassroots movement initiated by Alice will mean even more members of the surrounding area will get full treatment.
Unfortunately for Alice, treatment came too late for her and she passed away, leaving behind 2 children, Isa and Willie, with only their great-grandmother to care for them. She was, however, unable to provide for them due to age and living conditions, and so together with village leaders, it was decided that Isa and Willie would be the first 2 children to live in the Agoda Children's Village. On July 7, 2007, the Children's Village opened and has been run ever since by some amazing women. These mothers raised the children in a village environment, giving them a structure and boundaries akin to that of the children living in the village. The children have a roof over their head, a nice bed to sleep in, and clean clothes, but their daily lives are comparable to that of the kids they go to the school with in the village. To create a sustainable element to the children's village, a farm was created to provide food and sustenance for the children. This year, an income-generating project began where the children are learning the values of chicken keeping and eventually will be able to use profits from this project to further their education at the secondary level.
The Children's Village is really used as a temporary stopgap or band-aid to the overwhelming impact that the AIDS pandemic currently has on the community. The children living here are here because they have nowhere else to go and no living relatives who are capable of caring for them. Or they are living here to give a temporary reprieve for a family in a short-term crisis period that may get back on their feet while the children live a short time at the Children's Village. Eventually, plans are to have a vocational school there, and we hope that someday there will be no need for the Children's Village as our community outreach program and our development projects impact the village enough to help the community get back the structure normally used in Africa. This being where the village has the capability to care for any and all children, whether they be relatives or neighbors.